I warmly welcome you, dear viewers, on the Health TV. Nice to have you with us again. Our topic today is polyarthritis, and I am pleased that we have a patient with us today, someone affected by it, specifically a patient from the Biomed Centre Sonnenberg in Schwellbrunn, here in Switzerland. She will tell us her story, and above all, she will tell us how the doctors at the Biomed Centre succeeded with which therapy methods. But of course, we will hear from Dr. Stein about what was applied, which biological therapy methods, and I'm really looking forward to it. There are some people affected, and it is truly a burden, this disease, but we will hear more about it shortly. I invite you to join me in the conversation, and we will start right away. Welcome. Hello.
Hello.
I haven't mentioned yet that we are conducting this interview partly in English and partly in German, because our guest is English-speaking, so we are trying to have the interviews as well in German, as well in English. So first of all, a warm welcome to you, Georgina Gabor. You are a patient of the Biomed Centre Sonnenberg.
You are a patient of the Biomed Centre Sonnenberg.
Thank you for being here. Nice to have you here. Thank you so much for having me. A warm welcome, Georgina Gabor, as our patient at the Biomed Centre Sonnenberg in Schwellbrunn. Thank you for being here.
Thank you so much.
So, now to you, Dr. Med. Jürgen Strein, also from the Biomed Centre Sonnenberg, and you are a specialist in general medicine, biological cancer therapy. Your area of expertise is orthomolecular medicine, phytotherapy, neural therapy, and dark field microscopy, so a broad spectrum. And at the Biomed Centre Sonnenberg, you are primarily interested in biological therapy. Or therapy forms to help your patients out of their health problems. Is that correct? Did I summarize that correctly?
Yes, that is very well summarized. Thank you also for having me here. So we primarily try to help patients with natural methods. Sometimes, of course, this can also be temporary, that they need to continue taking allopathic medicine for the time being. Right now, in the field of rheumatological diseases, this is still the case. So we would by no means recommend stopping the allopathic medications immediately, because this can often even result in increased pain, but rather to reduce them slowly in collaboration with the respective therapist or doctor. Once the body has been offered a good alternative, you can often start to gradually phase out the anti-rheumatics. Gradually also because the body has overexerted itself. It has gotten used to these substances, and to avoid the so-called rebound phenomenon, meaning that there's an intensification of symptoms, it is done very, very gently.
To make allopathic remedies understandable for the viewer, so the medications prescribed according to conventional medical guidelines.
Exactly. These are predominantly anti-rheumatics in the case of the patient, pain relievers, anti-rheumatics.
Would you please be so kind, explain the term polyarthritis to us? What should we imagine it to be? Which tissues are involved?
So poly is basically the term for several, and arthritis is the term for joint inflammation. So polyarthritis means nothing other than that multiple joints can be inflamed. It is the lining located in the joints which becomes inflamed due to an autoimmune reaction, persistently inflamed.
Okay.
Excuse the very brief interruption, dear viewers. But you will now see a short excerpt from a very special broadcast. And if it excites you, then click on the corresponding link below on YouTube and watch the whole broadcast. Enjoy and goodbye, everyone.
It also deeply shocks me because these women are not really and properly informed. It has been proven that these silicone breast implants are not sealed right from the start. Proper information is key. Now, you have brought us a patient today.
Jetzt hast du uns heute eine Patientin eben mitgebracht.
I have already introduced her. Unfortunately, she only speaks English. English speaking, but we will try to translate it as best as possible so that our viewers can understand it well.
Und damit unsere Zuschauer das auch gut verstehen.
May I ask you, how did you feel when you came to the Biomed Centre? What was the problem you had and where?
Where?
Well,
Excuse me, what was your problem that you came to the Biomed Centre with? And what were the limitations?
Ja, was waren die Einschränkungen?
well, by the time I came to the Biomed Centre in Sonnenberg, a whole lot of experience have been behind me. And my experience testifies the incredible power of nutrition in creating disease, illness, maintaining illness, and this is the good news, reversing illness.
Okay.
To summarize why I said creating illness is very briefly, my background is I grew up in a family where healthy lifestyle and healthy nutrition has been of fundamental importance. I have always paid attention to healthy lifestyle, healthy eating, exercise, and all that is said to be part of the holistic concept of being healthy, mind and body, and the whole being. So with this background, what can go wrong? Well, everything went wrong because I forgot to put into practice the principles that I knew. I forgot to question my daily practices, and I forgot to make changes, and I allowed circumstances to navigate me in the wrong direction. So when a stressful event came, it triggered an autoimmune disease. But I believe by that time, it wasn't just a stressful event. It was years of bad nutrition that already created an environment in my body. So when stress came, my body was ready to be collapsed with an illness.
Okay.
And
We should make a stop at the moment and should translate what you said. Can you briefly summarize again what the starting position was?
Was die Ausgangsposition war?
Or what she just tried to explain to us?
So now in very short form, exactly, that she did not eat particularly well for many years, that this was basically the breeding ground for the illness, the breeding ground for feeling worse.
Eben der Nährboden, sich schlechter zu fühlen. Und,
but also now in the current case, that it has basically been the change through the dietary shift, which we will now talk about.
Yes.
Did you want to add something, or was it the nutrition and the stress?
To say something more, or was it the nutrition and the stress thing?
I would just like to say two more things. Like how nutrition can maintain illness, and finally the good news. Very briefly, when I was undergoing this treatment for nearly 2 years, and I was given medication according to Dr. Rao that was strong enough for elephants, with horrible side effects. When I asked my doctors to please stop the treatment, I was informed that it's not possible because it's a lifelong condition and I would have to be on immunosuppressive medication for the rest of my life. And as my condition worsens, which seemed to me that it was taken for granted by my doctors, that it will get worse, there was a plan what even stronger medication I would be given. And I just could not live with the thought. But during this time, nutrition was not mentioned, not even once. I was told to eat my yogurt. And that was, now I know that that was exactly not what I was supposed to do.
So she explained, to summarize quickly, that she was speaker one, faced with the fact by the doctors that this would probably have to remain lifelong now, and that she has to take immunosuppressants accordingly, so that she feels reasonably well, in quotes, doesn't feel the symptoms as much, and also received a false recommendation, a false dietary recommendation.
Fühlt, in Anführungszeichen, die Symptomatik nicht so sehr zu spüren bekommt und eine falsche Empfehlung, eine falsche Ernährungsempfehlung auch bekommen hat.
Did I understand that correctly?
Yes. Well, in the field of conventional medicine, dietary recommendations are always very brief, and that is precisely what's tragic in the area of rheumatic diseases, that there are not many therapy options available. So then, if the first antiemetic does not work well, you would switch to the next stronger level. And that is often lifelong for the patient, so taking it is associated.
What exactly was the physical problem you had?
Well, it started with my knee. It was hugely swollen, extremely painful, and I received the traditional medications after the exams, X-ray and MRI, and knee aspiration, cortisone. I was fine for a week, but then the pain and swelling appeared on my other knee, and then my elbow, my neck, basically all of my joints were involved.
So,
and my body did not.
I translate for the viewers. So it started with swollen knees or with a swollen knee, and then it spread to the next one and spread throughout the whole body, was accordingly painful, and was simply treated with conventional medicine, with medications. Treated, so far, so good. And then finally
And finally my doctors went through the procedure of testing several medications and finally putting me on an immunosuppressive treatment. And like I said, the side effects were absolutely horrible. And I started to ask my doctors to please stop the treatment. And patients don't do this because they are told that this is a lifelong condition. And while I was taking the medication, I was fine. There was no pain and I could eat whatever I wanted to eat. I made no lifestyle changes. But when my lab results are good enough, so my doctor agreed that we can try and stop the treatment, although she said that we know how to start the treatment, but we don't know how to stop it.
Okay.
Probably not a lot of experience with patients who stopped the treatment.
Okay. So conventional medicine, of course, conducts its usual examinations on the skeleton, what might be wrong.
Was könnte eben falsch sein.
That means you're exposed to X-rays and so on, all these things as well. In addition to what you already have anyway. And she also says that conventional medicine knows how to manage it fairly well, but they don't know how to stop it.
Es einigermaßen im Griff hat, aber man weiß nicht, wie man es stoppt.
Okay. What do you know more than conventional medicine here at the Biomed Centre?
Biomed Centre.
During the first consultation,
we usually also talk about nutrition. And I had the impression with Ms. Gabo that she would implement it very well, that she might also have a very good benefit.
Sehr gut umsetzen würde, dass sie möglicherweise einen sehr guten Benefit auch haben würde.
To introduce a plant-based diet and then strictly adhere to it until we have the opportunity to slowly phase out the antiemetic.
Die Aumatikum langsam auszuschleichen.
okay, that was all.
That was basically the foundation. So That's one of the most important things, I would say. Of course, we also started to focus on detoxification with her. So she also had infusions aimed at detoxification. Puppy-Me is a strongly pulsed magnetic field that can be used very well in pain therapy or especially after operations for quick regeneration. She had done that and also came for infusions weekly. And then after just 3 weeks, she already reported a very good result.
Okay. So after 3 weeks?
Ultimately, a diet change. We haven't done much of our therapies because she came once a week. But the foundation is really good nutrition. There is no better example to show this than with her.
So what was it you did wrong before?
Well, I can testify that during the stressful times in my life, and I was working and studying, even though I knew the principles, what I ate came out from some kind of a box.
Okay. I know.
And when my
fast food?
Well, almost.
Yeah, okay. Mm-hmm. Yeah.
Almost. But it's true that food had to be ready in 10 minutes when I went home from work, and I was tired and hungry.
Okay.
But when my doctor finally agreed to stop the treatment, and I still needed to go back to regular checkups, the checkup showed that I knew lab results were good enough, so they could not put me back on the treatment, but I knew that I was not well. For example, at that time it was my elbow, because it was moving all over my body, the arthritis, and I could not straighten my arm. Well, I didn't tell my doctor because I was so afraid that she would put me back on the medication. And I knew that I was not well. So I kept reading and learning and researching, and this is how I ended up finding the whole food plant-based diet, which is a term coined by Dr. T. Colin Campbell, the author of the China study, which refers to the way we eat. It's not a diet, it's not a lifestyle. As Dr. T. Colin Campbell says, this is life. Eat the whole food as it comes from the garden to the plate with minimal processing, no sugar, no oil, no salt. And I started to make my way to the kitchen and started to experiment. And I had to like the kitchen. There is just no other way other than cooking myself. And I'm also very fortunate that we have a young agricultural engineer living nearby in the neighborhood who has a garden, and I can buy all the ingredients for my cooking right from the garden. And it's wonderful.
Great.
So I started to cook for myself based on the whole food plant-based principles, and within 3 weeks I could straighten my arm and all pain was gone. And this was 6 years ago, and I have no pain ever since. Zero pain.
So I'll try to remember and summarize it all over again. The starting position or the diet was just very bad for a long time. Fast food, so everything had to be quick, and she was stressed. And that ultimately led to precisely the combination of all of it, her developing this polyarthritis. Then the arm, or rather the lab results at some point under conventional medical treatment was so good that she reduced the medication, and then it started with a severe pain in the arm, if I remember correctly. And then it wasn't movable without pain anymore. And she didn't even dare to tell her doctor because she didn't want to go back to the medication again. And then she came across the method of a diet that she tried to implement or implemented without, I wrote down, without sugar, salt and oil.
einer Ernährung, die sie dann versucht hat umzusetzen oder umgesetzt hat, ohne, ich habe mir aufgeschrieben, ohne Zucker, Salz und Öl.
And the whole fruit or the whole food just as it comes from nature, because nature must have thought of something by providing it to us like that.
Bereitzustellen.
And after just 3 weeks, it already ensured that she could then move her arm again without pain. This form of nutrition comes from your place.
We recommend plant-based, but we don't have this type of modification now. So ideally also the fruits as nature intended them. So that's also our preference, but we don't have any restrictions now. We don't prohibit using salt or oil.
Zu benutzen haben wir nicht.
Yes, there probably won't be that many patients who want to implement it that easily, whether they can or whatever.
Umsetzen wollen können, wie auch immer.
There is the inner pig dog. I don't know how to translate the inner pig dog for Mrs. Gabor. I asked him if the recommendation for this kind of food that you explained or the kind of nutrition, if it is from the Biomed Centre, but I'm sure most people wouldn't be able to do that without sugar or oil.
Kind of nutrition, if it comes from the Biomed Centre, but we are sure that most of the patients wouldn't have or wouldn't be able to do this as you told, without salt and without sugar and oil.
To be honest, taste was very important for me.
Yeah.
So if when I first started to experiment and the food wouldn't taste well, I wouldn't have transitioned. But fortunately, because I'm not a great cook, I wanted to be sure that I do the right thing. So I bought the China Study Cookbook, which was written by Dr. T. Colin Campbell's daughter, the China Study Cookbook. And I started to cook from that book because I was sure that that book was in line with all the principles of the whole food plant-based diet. And why is it called a whole food plant-based diet? Why is it not vegan? That's a question, because vegan is not necessarily healthy. The shops are full of vegan meat substitutes. Those are highly processed, full of sugar, full of additives. So that is not healthy. It's vegan. So back then, decades ago, when Dr. Campbell was doing his research, he coined the term whole food plant-based, because back then already the term vegan had negative connotations, even in the US. And this reflects more clearly what we eat. We eat the whole food, minimally processed, organic, straight from the garden. And this cookbook was just for me, with little experience, little patience to cook, and everything turned out wonderfully delicious. So that was convincing.
Okay, wonderful. So Mrs. Gawar is just telling us, as she did before, about the China Study Cookbook by Dr. Campbell, whole food plant-based. So the whole fruit plant-based, and that is not necessarily vegan.
Und das ist nicht zwingend vegan.
Or is not vegan in that sense, because what we find in the supermarket in terms of vegan products is all processed, contains sugar, and accordingly is often not better than anything else, except that no animal was harmed.
Oft als alles andere, also dass kein Tier zu Schaden kam. Ne?
Probably.
Absolutely.
Aber
that seems to be a very exciting way of eating. And she also said that it was also about enjoyment. And if that hadn't been the case, then it probably wouldn't have been so easy for her to implement. I have no idea yet, but I'll take a look at what it's all about. And maybe our viewers can also get something valuable out of it for themselves. Is there anything else you can say from your practice about polyarthritis, which is absolutely very, very important? So we've heard that diet plays a very important role.
Yes, so nutrition is indeed the be-all and end-all, and a plant-based diet, ideally also with natural foods, with a high proportion thereof, is certainly the ideal form of nutrition, especially in inflammatory rheumatic diseases. I see it that way too.
What other therapy forms do you use? Oh, we've already talked about detoxification infusions, for example.
Often, of course, there are also heavy metal burdens or organic toxin burdens present, which are then specifically treated.
Ganz gezielt behandelt werden.
Or just individual symptoms that are currently at the forefront.
Okay. But we have now really impressively seen what's possible in 3 weeks.
Möglich ist. So you're feeling absolutely healthy.
So you feel healthy meanwhile?
Ever since I transitioned to this whole food plant-based diet, I have zero pain, and even before my illness appeared, like I always had a little pain, like a little back pain.
Yeah, okay.
And I thought that living with pain is normal. And when my doctor said, well, our aim is no pain, my understanding was that, okay, no pain means the maximum bearable pain. But with this diet, the pain was gone. And it is actually zero pain.
Great.
I'm very happy for you.
That is it.
So she just said again that the diet was the game changer for her in the end. And since she started doing that, she occasionally had minor pains and thought, these occasional pains are quite normal in life and you just have to live with them. The main thing is that it's bearable, but today she knows, thanks to this plant-based diet, that it's not normal and that it's normal for the body not to hurt. That's the natural state.
Ist der natürliche Zustand, ne?
And fortunately, our body is always trying to maintain health at every moment of our existence. And we just have to give them the right resources, which brings us back to nutrition.
No? Good. Wonderful. Thank you very much for your story that you told us and for your recommendations toward to the plant-based and whole food, plant-based food. Thank you very much. And I wish you all the best.
Thank you for having me here. Thank you so much.
Thank you.
I also thank you. Dear Jürgen, for bringing us the patient and for providing such an impressive example of having found a solution so quickly, and above all for the indication that nothing special is needed, just a healthy and plant-based diet doesn't necessarily have to be vegan, and that's not necessarily inherently healthy.
Yes, absolutely.
Many say so. And yes, thank you very much. And to you too. All the best. I look forward to further conversations. Thank you very much. Thank you. I almost said, thank you very much. Thank you very much for being here, dear viewers. I hope we were able to overcome the language barriers to some extent. On behalf of my guests, I wish you health for your body, mind and soul. Stay mindful, vigilant and loving to yourself. And be sure to stop by again next time. I would be delighted. Until then, all the best. Bye.
Thank you very much for watching Swiss Health Television QS24. Please also visit Wikisana, register there and watch all these broadcasts without advertising interruptions. And please also subscribe to this YouTube channel. This helps not only us, but also the further spread of our channel. Here is the selection compiled for you. Have fun, all the best, until another time. Goodbye everyone.